No one knows when a natural disaster or emergency will strike. As emergency planners and responders, we must be prepared for anything at any time. One of the best ways to be prepared is to develop a common operating picture that is structured as all hazard in its foundation while maintaining utility when incident-specific strategies are required. Use of Geographical Information Systems, or GIS, provides such a solution. In the next 15 minutes, you will experience a small part of what the latest technology in GIS has to offer when developing common operating picture platforms. Utilizing datasets from multiple disciplines including law, healthcare, fire, weather, traffic, and other demographic information sources, nearly all of which are readily available in the public domain, GIS provides a graphical representation of the current situation, identifying potential hazards while also providing options to mitigate risk. This common operating picture can easily be shared across multiple disciplines and platforms so that everyone who is responding to the emergency or hazard has the same information at the same time, and that information is updated in nearly real time. In addition to layers that are available in the public domain, utilizing GIS as a common operating platform will also allow secure data that is not open to the public to be viewed by responders and planners that have the authorization to view that particular data within your organization. After all of these layers have been incorporated and they are being utilized within the GIS application, information is instantly available, such as healthcare facility name, total bed capacity, physical location, facility administrator, and contact phone number. In the case of general acute care hospitals, the type of beds that the facility is currently licensed for, such as burn, NICU, PICU, skilled nursing, general acute care, intensive care, perinatal, etc., is also identified. During an emergency response, one of the hardest things to predict is traffic patterns. Utilizing GIS, we can see the traffic patterns ahead of time and formulate response solutions accordingly based on what traffic is doing at that given time. One of the GIS layers available is real-time traffic that shows traffic conditions within the last 5 minutes, down to the city block level. This will eliminate a lot of confusion and perhaps even getting stuck in traffic while attempting to respond to an emergency or incident, such as ensuring on-time delivery of medical countermeasures. Another aspect that we have no control over is the weather. Having the ability to utilize GIS to see weather in real time and receive real-time weather alerts will make response efforts more effective, promote responder safety, and potentially see future hazards prior to their arrival based on weather-related information. Utilizing GIS is easily adaptable for emergency planning purposes, such as developing incident-specific plans for things such as earthquakes, tsunamis, severe weather events, and various public health threats. Consider the Zika virus, where monitoring local transmission or monitoring locations where the Aedes aegypti mosquitoes have been located could be helpful to developing response strategies. Incidents where the provision of large quantities of medical countermeasures is required could be planned for and visualized by developing a GIS layer that identifies points of dispensing, medical countermeasure warehouse locations, and retail pharmacy locations that can easily be identified and geocoded during the planning process. Having the ability to monitor reservoirs and streams in real time allows planners to see ahead of time when the floods are anticipated, leaving a window of time for evacuation of facilities and citizens prior to a flood event occurring, thus minimizing casualties. As emergency responders, having the ability to access information quickly will make response efforts much more efficient. For example, being able to display all of the medical facilities that have helipads in one touch makes air operation decision-making much more efficient. In the case of a mass casualty incident or other type of event that may require a trauma center, having the ability to find a trauma center to the level that you need by just selecting it from a drop-down menu will make your job as a planner or responder much simpler and effect a better response in a quicker amount of time. Using GIS, we have the ability to drop a pin or marker on the map, which serves as the epicenter of the incident and creates a buffer zone around it from anywhere from 10 to 100 miles, depending on what you choose. Within this buffer zone, any layer that you have added to the application has the potential to be displayed. Because no two incidents ever play out exactly the same and each local jurisdiction is unique, the application was developed to be completely customizable based on what your organization's response activities and/or responsibilities are. After the buffer zone has been created, all of the points that fall within that buffer zone and their corresponding data points such as facility type, administrator, or contact phone can be downloaded into a CSV file to be used in Excel and can be distributed between responders or added to reports. Using this GIS application for information sharing or situation reporting provides a visual representation of the situation at each of the incident locations. We now have the ability to collect data from either the field or operational or county-wide area or even the region and integrate it into our response common operating picture. Sharing this information with our federal partners can provide them with information that will enhance their support to the state should the need arise. Using mobile technology such as computer, smartphone, or tablet, situation reports and resource requests can now be submitted directly into the GIS system so that, upon submission, field or local jurisdiction information is made available within a minute to entities with a need to know, such as regional or state EOCs. Having this information nearly instantly available in an ever-changing environment makes the decision-making process and planning activities much more efficient, effective, and timely. In addition to being able to submit real-time data, there is also the ability to submit real-time imagery from the incident. Using the GIS application, importing images of a fire, levee break, or any other aspect of an incident could provide essential information to aid in the response or planning activities. As illustrated here, once the information has been submitted, it is imported directly into the GIS application and is instantly available via pop-up to any planner or responder that needs the information. Now that we have field and operational area data in the system, what do we do with it? There is an analysis tool on the back end of the application, allowing various types of analytics to be performed, such as trends, times, places, etc. It also allows the user to print out a situation report or resource request for documentation or submission to other entities that are not connected to the Common Operating Picture application. Other reports, documents, or other types of collected data can easily be uploaded and viewed, such as CASPER surveys, health and wellness checks, or pod throughput data. It really has no limits. The last, and I think most exciting piece of the GIS Common Operating Picture application that I would like to share with you is the Workforce module of the Online Application Suite. This provides the capability for planners and responders to visually assign tasks or missions and monitor assets or teams. Using EMS as an example, the application provides the ability to monitor your ambulance strike teams. Monitoring truck movement used for distribution of medical countermeasures is another identified application. The strike team leader or truck driver would need to have the Workforce application installed on his or her mobile device. Doing so allows the exchange of information between parties such as EOC staff monitoring the location of an ambulance or truck while sending information or new assignments to the team leader or driver in real time. To do so, you would need to create a mission within the back end of the application by adding the address or location and then assign that mission to the appropriate team that was capable of or required to complete that particular mission. After the mission has been assigned, the team leader would receive the assignment on their mobile device and communicate back to the sender their availability. The mobile application has the ability to start and stop multiple times throughout the duration of the task. During the course of completing the mission, the team leader or driver has the ability to add notes that are instantly transmitted back to the sender. All of this data can be observed in real time at the operations center. In addition to two-way communications, each of the teams or assets is being tracked within the GIS application, so planners and support staff will always know where assets or teams are at any given time. Having this capability, support staff can monitor the safety of the teams while in the field, and in the instance where an evacuation is ordered, the Operations Center can ensure that all teams have been accounted for. Thank you for your interest and attention during this brief glimpse into the real-time Visual Common Operating Picture demonstration. We hope this will further inspire your interest and imagination as to how GIS can best serve your response organization. If you would like further information, please send an email to me at jason.baker@cdph.ca.gov.